The following scenes depict motivational interviewing techniques. In the following scene, the patient Debbie Gatran is coming to the pharmacy with concerns about her health.
Description. What brings you here today?
I'm here because I have a little bit of concern about my health.
Okay. I have noticed that in your medical history you have an irregular heartbeat as well as high cholesterol. So do you mind if we talk about how different lifestyle can affect your health?
Sure, that sounds great.
Okay. What would you like to see different about your current situation?
Well, I just want to, just to be healthier.
Okay. So what step have you taken to improve your health?
Well, aside from taking care of my family, I stand a majority of my the time at work, so which I think is a great form of exercise.
Okay, it sounds like you have a really busy life, so focusing on staying healthy is tough, but how effective do you think that standing is compared to moderate intensity exercise such as walking or jogging?
I think that standing is really a great form of exercise. I never thought about walking or jogging, and personally, I just don't think I need it.
Okay.
In the previous scene, the pharmacist made sure to ask permission to speak about different lifestyles that affect the patient's health. Asking permission is important because it shows respect, as well as making the patient more likely to discuss changing without being felt as if they are being lectured to. By asking the patient what she would like to see different about her current situation, it evokes change talk, which can be used to address discrepancies between the patient's words and actions. Lastly, the pharmacist uses the technique known as reflective listening in order to validate the patient's feelings, as well as having the patient provide reasons to change without the pharmacist trying to persuade or lecture them to do so. In the following scene, Ms. Gatran has agreed to start exercising with her daughter and is stopping by at the pharmacy to look for advice for lowering her blood pressure.
Hello, how was the exercise routine with your daughter?
It was great. I've been doing this for a month.
How did you feel about the change you have made?
Um, I feel like when I exercise, I feel a little bit more energetic. So I think I'm gonna keep doing this.
Okay, it's clear that you are really trying to improve your health condition. What other aspect of your life would you be looking to improve in order to lower your blood pressure?
I don't really know because I think exercise is my only options.
Okay, another option to lower your blood pressure is to change your diet.
No way. I want to eat what I want. I don't want to talk any. I don't want to do anything else.
Okay, it seems that a diet modification may be something you aren't ready for. Do you mind if I talk to you about it?
Sure, but I'm not making any promises.
Um, a diet low in salt has been shown to lower blood pressure.
So salt is the only thing I need to watch out for.
Um, Not necessary. You overall want to maintain a balanced diet as well as limiting alcohol consumption and smoking.
Okay, I'll keep that in mind. I just don't want people to make fun of me when I go out. I mean, when dieting is boring. So when I go out, I want to eat whatever I want and drink whatever I want.
Okay, many people report feeling like you do. They want to change their diet but find it difficult. Someone on one hand, it sounds like you want to make some lifestyle change, and yet on the other hand, your image is more important.
I see what you're saying. I do care about my health, and I definitely want to make a changes.
Okay, on a scale of 1 to 10, how ready are you to make a change?
I say three. To be totally honest with you, I'm just not ready.
Okay, when you're ready to make a change, we can discuss in the future.
Okay, thank you.
In the previous scene, the pharmacist reinforces the patient's adherence to health improvement. This type of statement helps to support self-efficacy by giving the patients a voice to the changes they've made. Next, the patient is reluctant to make changes to her diet in fear of hurting her image. The pharmacist uses the technique known as normalizing in order to help the patient realize that there are many people experiencing the same difficulties. In addition, when the pharmacist brings to the attention of the patient that she is more concerned with her image than her health, the the pharmacist is deploying discrepancies between the patient's words and actions without evoking defensiveness or resistance. Lastly, the pharmacist uses their readiness to change technique that allows them to know where the patients are in terms of readiness, making them better prepared to recognize and deal with a patient's motivation to change. In this final scene, Ms. Gatran has had a couple of her medications switched around, requiring her to prick her finger in order to monitor her blood sugar. However, she hates finger pricks and as a result has poor adherence.
That's some of the difficulty you are experiencing.
To be honest, I just don't want to prick my finger at all.
Well, over the past few weeks, I have been working with you to take steps in the right direction for the sake of your health, but you don't want to prick your finger to monitor your blood sugar.
I told you I do not want to prick my finger.
On a scale of 1 to 10, how is your health?
10. I've been coming here for a week now, so I obviously care about my health.
It's clear that you are trying to improve your health. I have noticed that in the vast improvements you have made over the over the weeks.
I feel great. I just don't feel like I need to prick my finger.
I see that you aren't ready to make any immediate change, but do you mind if I speak to you for about a few minutes about the importance of blood sugar monitoring?
That's fine.
Some major problems can arise from uncontrolled blood sugars are heart problems, high blood pressure, and high cholesterol.
Really? I did not know that. That's been really counterproductive seeing, how I tried to lower my blood pressure this whole time.
Other problems that can develop are blurration, tingling, or numbing sensation of the hands, feet, or you might feeling fatigue, frequent urge to urinate, eat, and drink.
I did not know that. It sounds pretty serious.
To be honest with you, I'm not going to tell you what to do or not to do. I can only stress the importance of monitoring blood sugar in order to achieve ideal health.
Thank you. You've been very informative. I am ready to make this change, and I think I will try to prick my finger because I want to be a healthier person. I have done so much for these past couple weeks, so I don't want to. It'd be foolish for me just to stop now.
Okay, the way you handle this situation shows a lot of hard work and dedication. Let's meet and speak again in the following weeks to see how things are going.
Okay. Well, thank you so much.
In the final scene, the pharmacist provided advice and feedback to the patient, telling her of the possible outcomes if she were not to monitor and control her blood sugar. Providing feedback is a valuable technique because patients often have either little information or have misinformation about their behaviors or health conditions. Lastly, the pharmacist used affirmations in order to recognize the patient's strengths, successes, and efforts to change while sounding genuine and not overly ingratiating.
To wrap things up, the following scenario portrays various motivational interviewing techniques and how to apply them in practice, while making sure that the following 5 principles of motivation interviewing, which are expressing empathy, developing discrepancy, avoid argumentation, rolling with resistance, and supporting self-efficacy. Thank you for watching and have a great day.